Okay, so if we are speaking about the diagnosis of endometriosis, so I will be very systematic in diagnosis. The first step to diagnose women with endometriosis to be aware actually yourself about endometriosis, to be very literate about endometriosis. You read a lot, you are up to date with the literature because from history you can diagnose endometriosis from history itself. So listen carefully to what women complaining about her pattern of pain, how it happened. Did it take any medications that exaggerate, any diet that exaggerates this pain? When she stopped her contraceptive pills, is this pain increased or decreased? When she resumes these pills, increase or decrease? What kind or nature of this pain in relation to her period, in relation to her intercourse? Details of this pain. So I think first things first, history is very important and to be very precise and know exactly what you are asking about. The second thing, sometimes your doctor may ask to perform an internal exam, and in this internal exam, we will try to check the neck of the womb, the area around the womb itself, or sometimes they may find some endometriosis islands inside the vagina itself. Sometimes they may feel nodules in the back of the vagina between the rectum and the vagina. So it could be just raise our suspicious if we took proper history and then we did exam and we find something inside the examination. So this can raise our concern that you have endometriosis. Sometimes this is even before doing any scans. You can't feel any mass inside the pelvis. It could be deep endometriosis and you have chocolate cyst or endometriosis in the ovary and endometriosis on the other ovary, and both are very close. We are calling it kissing ovaries. The ovaries just enlarged and kissing each other, and you can feel it from the pelvis. You will find that all the womb, the ovaries are not moving while the examination. So this is called the frozen pelvis from too much scars, adhesion, everything. And in turn, you can suspect this is endometriosis. So if it speaks like many, if it acts like Minnie Mouse, or if it behaves like Minnie Mouse, so it's a Minnie Mouse, you know. So this is not a magic science to diagnose endometriosis. And now, because a long time ago, what we learned in medicine, the gold standard for diagnosis of endometriosis is laparoscopy and keyhole surgery. We simply go by a pencil or a pen, a camera like a pen in your belly bottom, and see inside your pelvis what's going on there. And we can see the islands, these islands of endometriosis. But believe me or not, this is something very strange. Sometimes you can't see endometriosis because it's also different shapes inside the lining of the womb. You may find black nodules, you may find brown nodules, you may find recent scars nodule, you may find active dots of endometriosis or active glands of endometriosis, just very hyperemic or very red. And you may find some windows inside the peritoneum itself. It's called the alabaster sign, some windows and gapping and cupping inside the peritoneum, which is the lining of your tummy, all the lining of your tummy, all the area around your pelvis. So it's very strange. And the recommendation was when you are doing laparoscopy is to take a biopsy from these glands and do histopathology exam. Then we can say it's endometriosis. And if you can imagine how many years a woman with endometriosis going to the doctor, prescribing painkiller, then prescribing hormonal medication, and then, okay, yeah, pain is not relieving, hormone is not helping, and side effect from hormone. So what else can I do, please, doctor? So, okay, it may be endometriosis. We will go by a laparoscopy. And if accidentally we couldn't find or suspect all these signs of endometriosis, I prescribe all the picture of endoscopic endometriosis, it could be misdiagnosed. And again, the woman, the poor lady, I can say she doesn't know what's causing this pain. Okay, so this is the problem about the diagnosis. So laparoscopic can be a diagnosis if it's for long time, and actually it was the gold standard. And now the debate between ultrasonography or MRI scan. So in ultrasonography, we can find actually if it's something in the pelvis, we can see endometriosis on the ovary, which is in the form of endometriosis. Endometrioma is found by like 40% in women with endometriosis. So it's very common, and we will discuss its effect on infertility later on. But you can find these nodules between the vagina and the back of the rectum, and sometimes this is very disfiguring nodule and very uncomfortable to have something inside the rectum, which makes you feeling very difficult sensation in passing, opening your bowel or anything, and it may need to have a surgery, and this may help you to just discuss with the surgeon how the surgery will be done for this kind of pain. So this can be diagnosed by ultrasound if you are aware and you have proper training and you know what you are looking for. If you have urinary symptoms, we can see bladder endometriosis, bladder nodules on the scan, on the 2D scan, not 3D scan, on the 2D scan. You can expect uterine nodule endometriosis by 2D scan. So this is very helpful to be aware about what's inside. If just listen, try to correlate everything with what you are seeing. Okay, and MRI scan is also helpful. We will recommend MRI scan because the debate MRI is a gold standard and ultrasound is a gold standard. This is after it was diagnosed of laparoscopy or surgery is the gold standard for diagnosis. Now, the debate between ultrasound and MRI, but I will recommend MRI scan for any symptoms away from the pelvis. So it can help to diagnose this endometriosis on the diaphragm, on the bowel itself, up around the stomach, in any place in your tummy, or on the lung. So it can help actually to see this endometriotic soft tissue gland. It's very helpful to have MRI scan too, especially if you are going to have a major surgery for endometriosis, okay, which another story, we'll speak about it later. So simply the diagnosis itself could be done very easy by taking proper history and start to work on it very early rather than waiting for long journey to be diagnosed by your specialist.